Very good evening, friends. Meeting again in the session of Materia Medica. And today we're going to learn one important node, very useful in homeopathic practice. In fact, a backbone of pediatric practice, specifically, or old age practice, specifically in cases where respiratory system gets involved. The skin is at fault. This remedy is a wonderful remedy, that is the Bacillinum anosode. There are two important preparations. One is called as a Bacillinum, which is prepared from macerated atypical tuberculous lung, and this remedy is introduced to the field by Dr. J.C. Burnett. And there is one more remedy which is more deep acting than the Bacillinum, is the tuberculinum, which is prepared from the pus from the tuberculosis. Very close to each other, but in depth they are different. As per my understanding, I used to use Bacillinum in generally in very acute conditions also, and it is very useful in certain chronic conditions also in order to prevent the recurrence. Tuberculinum is a big, well-proved remedy. As comparatively, Bacillinum is not that much well-proved as tuberculinum we know. But this remedy I have utilized for many purposes. It has a very close relationship with the antim-tart cough. There is much rattling, there is a much bronchoria, the expectoration here, it is quite easy over there. And this easy expectoration with a bronchoria, it comes out and it is continuously happening. And antim-tot, if you give, antim-tot never works. Antim-tot produces a little bit change, but it never remains persistent. It goes on and never gets changed. Always use as an intercurrent the Bacillinum. This remedy should not be given below 30. It should be given more than that. So 200, 1 m, 10 m, 50 mcm, these are the potencies generally I used to use. And this remedy is a wonderful intercurrent remedy where the respiratory complaints or respiratory system is at fault, where recurrence is the most important thing. In children generally who used to suffer often on the common cold, and they catch the cold, they get the cough, they get the expectoration, they get the discharge from the nose, and there is a continuous recurrence. Bacillinum 1 m, one dose is always helpful in such types of conditions. Then second important thing for which I used to prescribe this remedy is for the skin conditions, especially the ringworm, which is extended ringworm, or the remedies generally happens to be there that there is a very much recurrence, it persists for longer time of duration, and it involved the maximum skin area and not responding to the regular allopathic treatment. This remedy plays very vital role in stopping the ringworms. Here I used to use with 30th. To start with, I used to start it with 30th, then gradually increase 200, 1 m as an intercurrent doses. But extended ringworm always comes under the sphere of Bacillinum. There are many remedies, out of which four are very important. Bacillinum is one. Tellurium I used to use very commonly. The second one, sepia, is a very important remedy for the this ringworm tendencies. And last remedy which I used to think about ringworm is the Natrium muriaticum also. But generally, Bacillinum plays very vital role in order to tackle the infection and bring it back the extended ringworm over there. Third condition in which I used to use this Bacillinum anosode is old age patients where there is a COPD, chronic obstructive pulmonary disease, and with lot of congestion over their chest, in the chest, and they are just coughing and something comes out, it is a mucopurulent pus. and mm, severe bronchoria. In such types of cases also, to tackle the infection, the bacillinum plays the very vital role. And again, in old age, it should not be given below 30, or it should not be you should not go more than that directly. So 30 is better potency. Gradually, you lift it up with 200 and then 1 m in old patients specifically. So this remedy I used to use for such conditions. Very occasionally recurrent headache, which are not getting settled very easily. One intercurrent dose of Bacillinum always helps in such types of cases. So this is a wonderful node which is useful in our day-to-day practice. Let us learn it from Boericke's Materia Medica. Open the Boericke. Bacillinum, a maceration of typical tuberculous lungs introduced by Burnett, has been employed successfully in the treatment of tuberculosis. Its good effects seen in the change of sputum, which becomes decreased and more aerated and less purulent. So even in active stage of tuberculosis, Bacillinum sometimes helps, but I have not used for that purpose. Many forms of chronic non-tubercular diseases are influenced favorably by Bacillium, especially when bronchoria. Underline this, bronchoria. This is a much mucopurulent secretion and dyspnea are present. Respiratory pyorrhea. Patient comes and patient tells, doctor, from where this collection comes, I don't know, but it comes again and again and it is tremendous there. Then think of Bacillinum. The patient expects less. Bacillinum is specially indicated for lungs of old people. See, again, underline this is very important. Indicated for lungs of old people with chronic catarrhal condition and enfeebled pulmonary circulation, attacks of suffocation at night with difficult cough. So generally, the condition gets aggravated at night with lot of suffocation, breathlessness. There is suffocating catarrh, tubercular meningitis. So tuberculosis leading to meningitis, that is another point which one must consider. Fevers, falling of tartar of teeth, constant disposition to take cold. They easily catches the cold, very easily catches the cold, specifically children or old people. Head irritable and depressed, severe dip in headache, also as of a tight hoop over the head. So there is as if someone have put a tight hoop over the head. That type of pain is there. Ringworm on head. See the herpetic eruptions which happens to be there on the scalp also. So tinea capitis, this is a wonderful remedy. Tinea versicolor, tinea unguialis, tinea pedis. There are many varieties of herpes. The Bacillinum is a very good remedy over there. Then the eczema of eyelids. Again, one more feature one should not forget. Abdomen. This is wonderful remedy for abdominal pains, enlarged glands in the groins, and tabes mesenterica. Tabes mesenterica is lymph node inflammation in the abdominal cavity, and this is mesenteric glands which gets involved generally either because of inflammatory process, any bacterial infection, or sometimes even tubercular infection. Sudden diarrhea before breakfast, obstinate constipation with very offensive flatus. Respiratory, these are most important indication for this remedy. There is operation as if chest is blocked. Catarrhal dyspnea, inflammation of whole mucous membrane with dyspnea. Humid asthma. Bubbling rales and mucopurulent expectoration, and this you can catch on your stethoscope. This mucopurulent expectoration of bronchitic patient is mm, quite polybacillary. It's equally polybacillary. It is a mixture of diverse species and hence bacillinum is truly indicated. That has been said by Cartier. Often relieves congestion of lungs, thus paving way for other remedies in tuberculosis. So this is a wonderful remedy for old people as well as the infants or children where then there is tendency to catch cold and where the bronchoria is more marked, discharges are much more. Think about this remedy. Skin, ringworm, it is given in italics and that is the most important indication one should not forget. Pityriasis, all tinea versicolor, tinea condition. Eczema of eyelids, already we have discussed. The glands of the neck are enlarged and tender. Glandular affection is typical of tubercular miasm and this is tubercular remedy, so it is always there. Modalities: worse at night and early morning, worse by cold air. Relationship: antimonium iodatum, lachesis, ars iodatum, myosotis, levico. These are the remedies one must compare. Levico, it is 5 to 10 drops, follows an intercurrent where much debility is present. This is Burnett, what he has said about Levico. I have not used, I don't have any experience. Complementary Calcarea phos and Kalika. These are two complementary remedies. Compare, its effect seems to be identical to that of Cox tuberculinum. Both are useful. Both are useful in tubercular diathesis before thesis has developed. In the early stage of tubercular disease of glands, joints, skins and bones, these both remedies are useful. Soranum is other one should compare because tendency to catch cold, the chili remedy, here it should be compared. Seems to be its chronic equivalent. So, Soranum is considered to be its quite chronic equivalent. Bacillinum testium, that is another derivative of Bacillinum, acts specially on lower half of the body, but again, no detailed proving is there available. The dose is, this is important, should not be given below 30th and not repeated frequently. One dose a week often sufficient to bring about reaction. So this is what these are the very important hints one must consider. It should not be a remedy which should be repeated too fast. It is rapid in action and the good results ought to be seen soon. Otherwise, there is no need of repetition. So, this remedy one should not go on repeating off and on. And this remedy one must always recollect for the respiratory problems and for the skin conditions where it plays very vital role in our day-to-day practice. So, wonderful, small nosed but having a big value that we have learned in today's session. Tomorrow also we are going to meet with some other remedy and we'll discuss some examples of that remedy. So that's all for today. Thank you being there. We'll meet tomorrow.
Thank you, sir. Good night.
Good night.
Thank you.